Sure. Thanks, Shankar.
Hi, friends. Welcome to Soaring Through Chaos. Again, I'm Shankar Hemmady, and it's always a joy to be connected in this way. Sometimes it sounds super serious, like when we are talking about the pandemic, but the reality is, it is somewhere always in our background. The idea that some people may be losing lives or getting sick, and the people losing jobs. But this is where the great opportunities lie in our discomfort, in embracing the challenges and the impermanence. And with me here is an amazing person I got to know. I finally get to interview the one and only Dr. Rahul Gandhi. I know the first time I met him, I was like, oh, he does not look like that other Rahul Gandhi. And no, he doesn't. And we met at the Center for Compassion and
Are you saying
Altruism
I'm more
Research.
or less handsome?
So, well, with your COVID hair, you look a little cuter now. So, Dr. Rahul
Thanks.
Gandhi has been, I think, was born in India, studied in New Zealand in medicine, I think, and then Oxford and Harvard and all that. But we met him at the Stanford University School of Medicine's Center for Compassion. And tell me, how did you end up at the Center for Compassion, Rahul?
I can't believe it's been 8 years, Shankar. The Center for Compassion, or CCARE as it's called, the Altruism research, was always of interest to me because growing up, I'd seen a lot of religious violence. And since finishing high school in India and Oman, I was always interested in trying to figure out sort of the broader context around which we generate hate and divisiveness amongst people in societies. So whether it was Christians versus another group, or Hindus versus Muslims, or Indians versus Pakistani, narratives that one grows up with, this strong sense of nationalism or some fervor that is based on artificial grounds. I'd seen during curfews growing up, people being stabbed, people throwing or pelting stones at their neighbors and so on. This kind of, I guess, unsettled me to the point where I was wanting to find out what it is that was driving humanity towards not accepting, or what is it that we could do to encourage ourselves to become more inclusive, to nurture that sense of being loving. So at the end of high school, I managed to find myself in an ashram just outside of Bombay, where some of these sort of philosophies were being thrashed out. And the school that I went to was very, very fortunate to have been admitted to, was one called the Vedanta Academy. And I only stayed for a little while, but it changed the course of my thoughts, and I can confidently say the course of my life for a long time. And essentially, it was a school of philosophy that thrashed out man's relationship to himself or herself. And the premise being that the only person that you're going to spend the rest of your life with is yourself, consistently. And if you don't have a very good relationship with yourself, regardless of what else is around you, you're going to have a pretty miserable life. And then, premises such as those, and also that the unit of life being an experience, and the quality of the experience being a mixture of the subject and the object, and how throughout the Western world we've tried to enhance the object of experience in order to enhance the experience per se. So we say we have a better car, or we have better couches, or I lie back on the lazy boy, or whatever, which is the object of experience that's being enhanced. But very few pay attention to the subject of experience, which is one's own self. And if we were able to enhance the subject of experience, regardless of what external environment we find ourselves in, the combination of the subject plus the object in very rudimentary terms is still so brilliant that the experience becomes enlivened and absolutely resplendent. So there are great personalities in the world that have such magnanimous hearts that regardless of what they come into contact with, even if it's a very, very feeble object of experience, the fact that they've come into contact with it makes the experience just absolutely brilliant. So I was very fortunate to come across such people and learn from them. But my scientific background and the desire to return to an academic life brought me to New Zealand, and I studied medicine and neuroscience and so on. But I was always in this dichotomy. Is there a meaning to this spirituality that can be grounded in neuroscience? Is there a deeper way that I can reconcile these two seemingly very different worlds? And I found the Center for Compassion, Altruism, Research, Education as sort of one of these centers that's attempting to bridge this gap. So I was on a sabbatical year in 2012 where I was experiencing many phases of self-discovery. And I just happened to get in touch with a few people who led me there. One of them was a professor of psychiatry who had some dealings with Professor Doty. And I was very fortunate to have, made contact with yourself and a bunch of Buddhist monks at the same time. So they were talking about the nature of consciousness and how they were taking Buddhist monks through MRI machines whilst they were meditating and found that their amygdala were, a lot more enhanced than they would have been otherwise, and so on and so forth. So very interesting stuff that was going on. So I was
Yes,
naturally
yes.
drawn
In
to it.
fact, that was the beginning of my journey going into the depths of neuroscience. Like you, I also grew up in India and was fortunate to learn from the teachings of Sai Baba as well as Chinmaya Mission. And I was also a teacher for Bal Vihar in San
Mm-hmm.
Francisco for the Chinmaya Mission Bal Vihar for 3 years. And it's such a blessing to learn about Sanatan Dharma, which, unlike many other so-called religions, is very, very pluralistic and is very open. So the teachings of Sanatan Dharma being that Bahujana Hitaya, Bahujana Sukhaya, you think about the good of all, and there is no separation between me and the other, no matter which community, which religion, which gender, all that, as Gujus would say, doesn't matter. Part of you is Gujarati and part
It's
of you
true.
is Konkani, which is another coincidence. I live in Gujarat,
That's
but
right.
I was born of Goan Konkani parents, and you are also half and half, huh? Something like that.
That's right. My mother's Konkani, my dad's Gujarati. They were neighbors. Good things came
Wow.
of it. Exhibit A is here. Exhibit B is in Paris. Uh,
Exhibit A.
um, but but yeah, I'm reminded of this quote when someone asked Ramana Maharishi, "How do we treat others?" And he looked at them very plainly, and then he said very bluntly, he said, "There are no others,"
There are no
which is so
others.
beautiful.
Yeah, yeah.
Mm.
Well, we refer to ethnicities, whether it's our state, our religion, and this and that, as if it's sacrosanct and it's fixed, but it is not. And I lived in Mexico for 4 months, and before I know it, I'm like, get up in the morning, buenos dias, cómo estás, because it becomes a part of the DNA. It becomes a part of our um, our brain starts wiring differently. You mentioned
Agreed.
neuroscience, and yeah, it was my journey in understanding the neuroscience of happiness, the neuroscience of dharma, if you can call it, the neuroscience of
Hmm.
righteous living, the neuroscience of being happy is not just I being happy, but we being happy. Bahujana Hitaya, Bahujana Sukhaya literally is the probably the conclusion of common humanity, amygdala hijacking, prefrontal cortex, and how the mirror neurons, all these things come into context.
Correct.
And I'm speaking your language now. All I have is a certificate in neuroscience, but it changed my life. I've been on and off volunteering with CCARE. Ever a year before I met you, I started volunteering. Then I actually studied with doctors, psychiatrists, psychologists, neuroscientists, and then continued learning because I felt that something grounded in science, art, and practice is amazing. So tell me more. Since that time when we met, you went to, was it to Harvard and all that? So what kind of things have you been doing? And Are you involved in now the COVID efforts in different countries, particularly in New Zealand, which seems to have done great stuff?
Yeah, Shankar, thanks. It became evident to me when I was practicing medicine in New Zealand that not only did I need to scratch this itch to understand whether there was a way to reconcile my personal and professional worlds, and at the time, my personal world was very much rooted in um, trying to understand neuroscience and how to reconcile states of consciousness, um, as I'd learned in very ancient philosophical texts versus what we knew. And there's a lot that we don't know. Mm, but then it changed ever since I started practicing medicine. My focus became that on um, of trying to mitigate the scourge of inequity. And inequities are very, very evident in medicine, and anyone who's practicing for long enough and sincerely enough will recognize that at some level, they are what we say quite commonly, they're mopping the floor whilst the tap is on. So,
Oh,
which basically means that we are fixing patients at the bedside and sending them home thinking that we've fixed the issue, but all we've done is mop the floor. The real determinants of health, the real determinants, the real social issues that have caused them to become sick in the first place aren't even addressed. And the sad bit is that we don't have the capability, we don't have the bandwidth, and we don't have the platform to be able to make a difference. So that led me, and you might think a country like New Zealand is so far away and it's so beautiful and so well developed, and there's a lot of measures of inequity that have been addressed. And I do
hmm.
not disagree. But there is plenty of inequity in our own backyards here in New Zealand. But you don't have to go very far. I don't think any country has been spared. I don't think any civilization has been spared. One has to look at a simple thing that is so pervasive, yet so ridiculous. Even in our times, it is 2020, and one woman dies every 3 to 4 minutes in childbirth somewhere in the world, Shankar. Patriarchy is everywhere. No country has been spared. No religion has been spared. And it is a real scourge of our times. And that is only the beginning of this structural inequity. If you look at the caste systems and their pervasiveness, if you look at indigenous health and how poorly they do, then you realize how perpetual these cycles are. The fact that they don't have good access to health means that they do not have an ability or a potential to do well in their schools or in their jobs. And subsequently, they don't have an adequate income or a reliable source of income. And then they don't have housing, they have fewer reproductive choices, especially the women, and the cycle perpetuates. It's not enough to say that they are lazy or they are, or in fact, it's absolutely wrong. It's criminal to say that they're lazy or they don't do enough work or they're not hard. They obviously aren't educated enough or aren't motivated and all of this. There is a deeper cause to the inequity, and that in many ways is a structural problem. It's called structural violence. And it's a term that one of my professors by the name of Paul Farmer, whose work I've been quite deeply influenced by, and he's a bit of a champion of public health in the Americas and also in Africa, in Rwanda. He has set up in Sierra Leone, he set up this wonderful organization called Partners in Health because he's an anthropologist and an infectious disease specialist. So he studied this at the very root. Anyway, I wanted to try and understand how to bring changes structurally. And for that, I did a social entrepreneurship MBA at Oxford and followed that up with a Master of Public Health at Harvard. I mean, it doesn't mean a thing that I went there or I could have done these things anywhere, but it was useful to me because the company that I had um, inspired me to make me believe that perhaps I could also be an agent of change. You don't go there for the knowledges. You can get the knowledge these days on YouTube. You go there so that you can become part of a group that will push you to believe in things that you would not have otherwise marked yourself to believe. So it's, yeah, so those are the sort of powerful networks that one could potentially get in places like those. So then the onus then is again on me. Just by going to those places, one doesn't arrive in any way. It doesn't mean that I'm successful or anything like that. It means that now the burden is on me to make something of those experiences. So watch this
It comes with
space.
responsibility.
Yeah, it's a
In
huge
fact,
responsibility.
after spending a few years studying the neuroscience of happiness and compassion at the Greater Good Science Center at Berkeley and also at the Center for Compassion at Stanford, I realized, my wife and I both realized we should do something in India. And that, like you, she is in the medical field. And I heard the good news that you have also done some work in Assam and are interested in continuing that forward. Could you give us some idea of what it is that you've done and what would you like to do to Mother India? What would you like to do in Mother India? And is that something you
Goodness.
can talk about?
I'm very happy to talk about it. The current political situation doesn't allow me to work in Assam closely with the group that I've been liaising with and the kind of work that I want to do. But I can certainly tell you about the vision and the dream. Um, I already mentioned how women are dying in pregnancy. And these women are mostly concentrated in certain areas of the world. You'll be very surprised to know, Shankar, that India has made great strides in maternal mortality in many states. So, India still has the highest number of maternal deaths in the world, but the rates of maternal mortality have dropped significantly in a lot of states. Reproductive choices have become better for women, but also women can access more services. Eh, These states have shown a lot of infrastructural growth and so on. Unfortunately, there's one state where these metrics haven't really budged, and that state is Assam. That's where our tea comes from. So every morning when you boil your cup of tea, you must think of where the supply chain is um, originating and how these Assamese women are hired between the ages of 15 to 50. They work for about 12 hours a day picking tea leaves because their delicate fingers will not hurt the plant. Then they're given 2 liters of salty tea to quell their hunger, given one
Wow.
meal a day, and then are told to stay, or rather are given the choice for their families to stay in these quarters within the tea gardens. They're beautiful, lush tea gardens managed by some of the biggest corporate houses in the world, Shankar. These women cook for their whole families when they get home and then eat what's left over, which is very little. Plus, they have often, because they are in that reproductive age group, they have menstrual bleeding, so they bleed, lose iron through blood. Plus, they don't have much meat in their diet, so they don't have much in the way of dietary sources of iron. And they have hookworms, which are present ubiquitously in soil. The hookworms also leach their iron. So these women, when they get pregnant, are severely anemic. And the solution to their anemia um, is obviously trying to replace their iron, but actually it's a bigger problem than that, because even if you replace the iron, I don't know if men have ever had this problem, because if it was a man's problem, it would be fixed, to be quite honest, but it's a woman's problem, so it's not fixed quite easily. They've been given iron tablets to take. Now little girls and um, young adolescents at school are given iron tablets to ingest. These iron tablets are horrendous. I don't know if you've ever taken iron supplementation. They're horrendous to take. They cause constipation. They're not properly absorbed. So more often than not, there's non-compliance. It's a little protest, actually. I don't want to take this. It makes me sick. Fair enough. As a result, when they do get pregnant, they're severely anemic. And even when they bleed when they bleed a little bit during pregnancy or during childbirth, there's a real danger of them exsanguinating, which is to say they lose all of their blood. And so they come to hospital, which is often 10 hours away, in dire straits, with very low hemoglobin and with medical conditions that could have been preventable had they been checked more regularly. So in a 40-week pregnancy, it's very few times that they actually get to see a doctor formally and have proper follow-ups. By the time they show up at hospital, that hospital is overcrowded, understaffed, one woman often shares a bed with 4 other women and has to
Wow.
birth on the floor, and is abused constantly by the staff, who are not able to really cater to anyone and are under resourced and quite overworked. So in that sort of setting, when these women give birth, there are many complications that can occur, and women die quite frequently. The issue with that also, Shankar, is that these people decide then to not birth in hospitals. They're birthing in their backyards. So if the baby is coming out shoulder first, or backside first, then there are so many complications that can be prevented during pregnancy. Now, I'm not an obstetrician, but I don't need to be one to be able to see that this is a huge issue. So the idea is to try and bring regular care, periodic care, that is closer to these women. So if you look at what's regular, what's periodic, and what's ubiquitous in a country like India, I mean, the British, when they left, they took away a lot, but they left this massive infrastructure of railway networks, which was actually to suck out all the wealth from India. But we could potentially use this for good when we decided to make a makeshift train carriage, and turn it into a obstetric unit. So a van that could give iron infusions and perform basic checks, where it would detach itself at particular railway stations and then act as mobile obstetric units. And then once the women of the area, who can access these railway stations quite easily because they do their shopping there, they do all sorts of community things in and around these railway platforms, they can come in and have themselves tested, get iron infusions, get their ultrasounds, and then be marked as high, medium, or low risk, so that they can be followed up in their next 6-week appointment at the same station or another one that the train carriage will be waiting for them at. So it's a network that we're trying to build of mobile obstetric units that would detach and attach themselves to passing trains and existing services. The project is called On Track Births. And we found some seed funding, and we're raring to go in Assam. It's just that we need governmental approvals and a lot of sort of bureaucratic loopholes to be able to come through, so that we can hit the ground running, so to speak. So we're trying to prevent complications at the end of pregnancy. There's no use trying to create a big hospital with all the infrastructure and all sorts of checklists when something more basic upstream has to be fixed. There's no use trying to fix the downstream problem when the problem is actually upstream. So that's our project that we're trying to get off the ground.
Wow, I had no idea of the complexities and the details to which you have really looked at. But I know one thing, each time I have tea now, especially Darjeeling tea or any of those brands, it'll remind me of those little girls that have to toil through, and not just little girls, but women of 15 to 50, which is what they call Garbhavati, or the age where they can have babies. Good. I mean, good to learn. At the same time, I know I'm going to feel it every time I have tea now, what they go through. And iron deficiency, as you pointed out, is everywhere, including in most countries, for women in particular, because of pregnancy and childbirth and all that.
That's right.
And then we have the complication of thalassemia.
Mm-hmm.
I'm whatever. There's 2 types of thalassemia. One which is very dangerous. The other one which is at risk during certain
That's
conditions.
right.
So more than
That's right.
half of India, including me, have that condition, the thalassemia, which is the irregular RBCs, which
Right.
can complicate things much more, right? Which
Agreed.
in combination with anemia, it's very dangerous.
It is, and it's difficult. You cannot give iron to someone who's thalassemic because it might be dangerous for them. So it needs a
Oh,
proper assessment. It needs a
okay. I
proper
did not
assessment. They
know
might
that.
not be iron deficient, but
Yeah,
and so if you give them extra iron, then that's of no use.
that
It
will
might actually cause
cause
a toxicity.
toxicity. Oh, wow.
That's right. So you can't just give iron willy-nilly. You need to be able to test for thalassemic traits and so on. So yeah, essentially, it's important to have a medical opinion, which is why we need doctors on these carriages, and and this whole top-down approach doesn't work. You need to you need to have sort of a community-based ownership of that project. And so a lot of my MBA was trying to think about how is it that we can involve all of the different stakeholders, public, private, everybody, into contributing towards social good. Because one of the takeaways is that you can do well and do good. And the other big takeaway is that there is no use having this us versus them narrative in this day and age. If we survive this pandemic, there will be others. If we survive climate change, then we will have greater challenges ahead of us. The idea that there is an us versus them between the public world and the private world, or the right and the left, and all of this just is at one level so infuriating, because we are all in this ship and it is sinking together. Rather, it is sinking and we're together in this. So it doesn't matter what end of the ship you're on. Um, I feel that if we sink together. So there is no use having any kind of moral high ground. Of course, you've got to hold each other accountable, but it's a collective responsibility to come together to solve these pressing issues. And if you think that we're far away or far removed from these issues, one just has to look in our own backyard to find sources of inequity. The fact that you're drinking Darjeeling tea or having some, a conversation on a laptop where the cobalt in the motherboard has been mined by, flogging children in Congo. We are all complicit. And because we are complicit, we should have that level of responsibility to fix the inequities that we can see.
So, you bring up something very important. Globalization has caused global inequities now because, like, Darjeeling tea is no longer just a privilege to be used in India, but it goes globally. And so,
Yes.
also, coffee and cacao, cocoa and chocolate have gone worldwide. And now you have more and more things like that. Even the quinoa, for example, the locals in South America may not get quinoa, but it's become such an expensive substitute for rice and for diabetics and others that it's now become premium. Cacao is also premium, and also who
Agreed.
knows,
Agreed.
Darjeeling tea may also be premium. The people
So
who are
true.
actually working on it may not even have access to it. So, do you think the current drive from global to local, or people are now saying this is nonsense, we should not go after the global economy, we should at least focus on the local economies? Is that a good direction? Do you
I,
think it'll solve problems, or could it complicate other things? Say, for example, in the context of Assam, what do you think? I'm asking a question as an economist or as a planner, because you also have a business and a public health background. So, what do you
so
think?
it's a very difficult question to answer because it's a multi-layered, um, complex issue. If you try to solve one problem, the experts might think that another problem that's rearing its ugly head is more important. And therefore, it is worth not doing anything about the problem that you're trying to fix. So for instance, just as an example, and I'm diverting the question because uh, not because I'm a diplomat and my name is Rahul Gandhi, but more because I think you'll have parallels in this in this story, um, that will not answer your question, but you'll see why I'm not answering your question. So let's take the example of the WHO and its so-called reluctance to call Ebola a pandemic back in 2013. Was it 2013 or 2015?
Yeah, we had
Um,
multiple outbreaks.
that's right. So the Ebola outbreak, and I'm trying to figure out the West African Ebola virus outbreak, happened in 3 countries, right? And the Director General of the WHO at the time was a wonderful lady who was no stranger to pandemics. She had handled the SARS outbreak in Hong Kong. So she was not a stranger. However, the WHO was severely criticized for not reacting sooner and calling the Ebola pandemic a pandemic. And it wasn't because the numbers weren't there as much, or the there was not much evidence that this was something that was rapidly spreading, or that more than one country was involved. It was for a real complex issue, presumably, that did not allow the WHO to wantonly declare it a pandemic within 3 specific countries. So Sierra Leone, Liberia, and the Democratic Republic of Congo. The governments of those countries pleaded to the WHO about the potential downsides of calling it a pandemic, saying that trade would stop, tourism would stop, lifestyles would collapse, and the economies would collapse. So then the real question is, if you try to fix one problem by calling something a pandemic, you create another problem by ruining the economy, something that we are seeing now. And at the behest of a lot of right-wing, economically oriented forces within parliaments, we are seeing opening up of economies at the cost of human lives during this current pandemic. So Dr. Margaret Chan, she was the Director General of the WHO, had a similar problem back in the Ebola outbreak, where she could not call it because the governments were strongly resisting, saying you'll create a bigger wave of poverty. And with poverty comes a lot of issues that are also public health problems. So in order to try and save one thing, you let go or sacrifice a lot of other things. So you've asked me a very you've asked me a very complex question with many layers of issues that are all intertwined about local versus global. Of course, there are advantages to localization, but then the global markets dictate what the locals should do, unfortunately. And I don't think I'm qualified enough to be able to answer beyond what I've said. I probably need a PhD, Shankar, and I think I have enough letters after my name now.
And again, I mean, there are always these drives. We've had when actually your namesake Rahul Gandhi was not Rahul Gandhi, Rajiv Gandhi was the prime minister. We went into the wave of globalization. There was economic prosperity. The software industry of India is now the #1 industry, I think, in India itself, where the market caps of TCS being the largest Tata Consultancy Services, the company I worked for more than 35 years ago, is now the single largest market cap in India. So there are positives, but on the other hand, we've seen the challenges also of globalization and
Oh my goodness.
basic manufacturing
Shankar,
infrastructure industries going out.
I grew up in Bangalore,
Wow,
and
you've seen it
Bangalore
all.
had 400 lakes when I was there. Now there
That's
are fewer
true.
than 40.
That's true.
Now the
And
city looks like a giant supermarket, and there are very few patches of Bangalore that I recognize. It is
wow,
heart-wrenching. It is heart-wrenching. We did not have air conditioners or even the need to use um, fans at home. The electric fan was very seldom a feature of a Bangalorean house because it was so incredibly cool most days of the year that it was called the Garden City for a reason. And now temperatures are soaring over 40 degrees on a regular basis. When I walk down the streets of Bangalore, I see international brands, neoliberalization. I see all of these people trying to make something out of nothing, and there's enormous pressure for it to keep growing. But unfortunately, it's pillaged the land and the preciousness of what made Bangalore. Bangalore, it's a shadow of its former self, even though it's this giant beast, it's this monstrosity, this concrete jungle. Unfortunately, all we can think about are economic metrics. We have destroyed entire ecosystems and the lifeblood that Bangalore was, in my opinion.
yeah, yeah. And again, we're talking, I mean, some countries are now talking about gross national happiness instead of GNP and all. Very tricky. I mean, as you said, it's a very nuanced thing. The tech industry has created literally millions of jobs in India. I have friends in every corner of India who work in the electronics and IT sector, and because that was where I worked most of my work life. But at the same time, yeah, Bangalore is no longer the. Also, like even caught fire, I think at one point. So
Yeah, broke my
yeah,
heart. Mm.
so it's
But, you know,
it's a very sad
yes.
situation on
So,
environmental and other fronts.
you know, the biggest problems. This is my issue, and it's a big dichotomy that I keep facing. On the one hand, here I am trying to promote um, good public health and saving human lives and so on and so forth. Um, but we are constantly shying away from two of the biggest, the greatest issues that we face with regards to climate change and sustainability. We're not talking about them. The first is having fewer children. No country is, apart from China back in whenever it started the one child policy, and China I will never use as an exemplar for what a society should be like because of its dubious human rights records. And the fact that they have modern day gulags in China is abhorrent. Um, but apart from China, there are very few countries that have even broached this idea that people should have fewer children, let alone made it mandatory for people to adopt, or the there's been many studies to show our impact on climate change and our individual actions that will diminish our carbon footprint. And so people say, all right, well, I have an electric car, or I'm going to not use my dryer, or I'm going to use clean, eco-friendly bulbs, or I'm going to go vegan, and so on and so forth. But these are all very minuscule 1 or 2 units worth of efforts. The greatest effort, and one that measures sort of 60 units, which is exponentially higher than the 1 or 2 unit measures that we can take, is having one fewer child. And no one's actually talked about that. So it's not a concerted effort by people. We are reproducing at a great rate of knots, and there is not a single human problem that can be solved by having more humans on the planet. And unfortunately, this is not a narrative that's been widely promulgated. We are encouraging people to reproduce.
Very interesting you mentioned that because when I was growing up, we had that hum do hamare do, and it has continued in various forms. In fact, it's very common now in urban India, in the big metros, that people have one child, or some people even say, I don't want to add to the burden of earth, I'll adopt a child, I will not give birth to a child. So it is increasing, but the percentage of people being that is still small. Middle class in India, particularly, seems to be on that track in urban India, in metros. Yeah,
Yeah, it also
but
has to do
again,
with female reproductive choices. If
yes,
women are
yes.
given education and women are given the ability to choose when they have children, you have more robust economies at the end of the day, because there are fewer people at the bottom um, of the age pyramid that are dependent. So you have more people within the 15 to 65 age group that can contribute to the economy. And in population economic terms, this is called the demographic dividend. You can actually realize the demographic dividend if you simply do two things. So if there was anything that I would urge public health advocates, or they already know this, but anyone who's thinking about public health, or what are the biggest um, um, sort of changes that policymakers can adopt to make greatest impacts in public health, is send girls to school and allow them to have reproductive choices, so they have fewer children that are spaced apart so that they can get educated.
Very interesting that you speak about that in the United States and Western Europe, as well as many other so-called developed nations, actually have a negative growth rate, indigenous negative growth rate of population. And to a certain extent, urban India is definitely on the same track. fewer children, and very high, education rate for women. Um, Gujarat, for example, was probably the first state to do that. From kindergarten all the way through finishing college, girls' education in government schools and colleges is free, which is amazing, and it has made a tangible difference. Again, among other countries, India has made it very particular to institute a national law against what do you call female feticide. You cannot even know the gender of the child legally, because a lot of people have aborted. On one hand, they don't want to stop abortion because unwanted pregnancies, unwanted children will cause public health or overall issue in society. But on the other hand, aborting on the basis of gender has caused gender equality. I mean, what do you call the more
Yeah, I
when
agree.
the boys than girls. So I find that
Yes,
India
but
has
one
been
can't
very
rest on
progressive in
these.
these days.
I agree, but one can't rest on these laurels. India still has the highest maternal mortalities in the world. 70% of Indian women might be anemic, according to a recent estimate. Um, 40% of under 5 children in India are stunted. Please try and
40%. Wow.
grasp this number
Wow.
of under fives in India. 38 to 40%, according to a World Bank study recently, um, was shown to lack nutritional, um, or rather have nutritional deficiencies. So they don't reach their full potential. In fact, the erstwhile president of the World Bank was giving us a lecture, and he said, "I'm really worried about India." And we asked him why, and he gave us this statistic, and he says, "We're not going to be able to reach our intellectual potential because
Yeah.
there are certain phases, there are growth spurts during which our brains develop. And if we are deficient in iron, if we are deficient in certain, key nutritional sort of elements, um, the brain does not develop properly and you're not able to reach your intellectual capacity. So then even things like artificial intelligence could replace a lot of the jobs that require humans, because we're not going to be able to compete against other nations and so on, which was, I thought, a very damning indictment of what was happening. The fact that India spends 1.13% of its GDP on public health, and we have a bloody space program. Sorry to swear, but I feel absolutely livid, because our priorities are in the wrong place. We're erecting statues and making bullet trains by mowing, acres and acres of farmers' lands, and taking giant loans for projects that really have very little benefit to the broader populace, and the real issues that need to be confronted. And I'm not saying that we should never have space programs. I'm not saying that they are mutually exclusive, or one thing can lead to the betterment of the other. But when your house is on fire, you're not trying to buy a new carpet for the other room. You need to be able to put out the fire. It's absolutely mind-boggling that our priorities have been shifted away from this narrative to focus on things that are largely irrelevant, and fuel some sort of a nationalistic jingoism or a fervor that has no place in society.
Well, I'm glad you're talking about the difficult things. And in fact, I want you to focus on one area that is of interest to me, particularly during this pandemic. There's a lot of pain everywhere. This is global, whether it is a lack of, particularly loss of life, especially worries about elders and little children. Children with deficiencies are at anybody with deficiencies are at a higher risk. Anybody with comorbidities like diabetes, blood pressure, which are very common in India in certain groups, there is a high risk. So there's fear of life and fear of health. And then there's fear of jobs, much 10 times more economic, layoffs and losing jobs and even not being able to work. And then there is the panic that comes with it, the mental health, amygdala hijacking that we see everywhere. My question to you is, what can individuals do? You and I, a lot of us tend to feel helpless. But I believe there is something we individually can do in our communities, wherever we are. So, what would you recommend people do so that they don't sit waiting for the pandemic to end? Nobody knows when it will really end.
Mm.
Number two, postponing our lives. It doesn't make sense, and getting depressed. What can we do to find
Sure.
meaning through these difficulties?
So it's a really good question, and one that I might not have the perfect answer to, because I haven't found my way of being able to deal with it. Um, this is the chaos that you're referring to. I'm not an expert at dealing with chaos, but what one can do is continue to expand one's opportunities to learn and to process, thereby allowing yourself to create avenues through which you can make differences. So I would really urge people to start reading as broadly as they can, reading works of philosophers, reading works of people who've gone and changed the world, what made them do what they did. Um, so education is not just learning the ABCDs or passing a few exams. That's far removed from what education truly is. It's about trying to reframe your own paradigms constantly, and the frameworks around which you peg your problems need to be rearranged to look at it differently. And then you might find ways in which your own personalities and your own strengths align to be able to create a solution, or create ways in which you can express yourself the best. So, you have art activists that are able to raise enormous levels of consciousness through their work. And you might think, what does song have to do with political consciousness? Or what does a painting have to do with anything? There's a wonderful Polish set of films called the Decalogue, in which there is a short film that changed the Polish law on capital punishment, because the film was called a short film about killing. And so
Wow.
that film was so powerful that it led a huge movement to be able to change policy that dealt with criminals that were on death row, to be able to reverse their capital punishment verdicts. So I feel that it's all about trying to expand your mind. So no one is exempt from this. I think, the highest PhD scholar to the person who is, at the pottery wheel, everybody has the ability to infuse their own um, personalities into for a cause, and the cause is a collective. And we're as weak as the weakest link, or rather as strong as the weakest link, they say. So I feel very strongly that the only way, you're asking me for a simple solution, and there isn't, but the only thing we can do is continue to expand our knowledges, so that we find inspiration to head down a path that can allow us to make a difference in our own ecosystem. Do you know what I mean?
You just reminded me it's been 8 years since we met. And if I still have an aspiration to meet a Rahul Gandhi, it'll be just you, not the other one. So
Oh,
it's
that's
not a
very kind.
political
Thank
statement.
you. Very
This is
generous.
not. But yeah, I'm so looking forward to maybe meeting you here in India or somewhere else. And if there's any way anyone can contribute to the efforts you're doing and or learn from you, what's a good way they can reach you? Do you use social
Oh,
media? What's the best
feel
way for
free
them to reach
to.
you?
Yeah, absolutely. I mean, I'm available on Twitter and Facebook and Instagram. Or my email is rahul@ontrackbirths.com, and I will have that for a while. So please feel
Great, great.
free
I will,
to contribute. We
particularly in
need
your
all
case,
sorts of help.
I'll give the full URL so that people know how to reach you. Otherwise, they may end up with the other Rahul Gandhi, which is fine, but not if they're interested in talking to you. I'll make sure that I give you the right URL
I'd
to
be
your
very, very
Twitter,
pleased and
Facebook.
honored if people were to reach out. I am always looking to make new connections. I think, like I said, we're all in this together, and this is by no means my effort or my endeavor. That'll be just very naive. Um, I think we're all in this boat, and it is sinking, and we need to find ways to plug the damn leak.
Well, thank you again. And for those of you who are still listening, it's a joy to be able to explore difficult topics what to do with health, what to do with poverty, what to do with the challenges and the opportunities globalization has created, what to do with the lakes in Bangalore, or these are all real challenges, and we are all facing them together. Both Rahul and I think our home states. At least I was born in Karnataka also, so it hurts to see on one hand Bangalore being the Silicon Valley of India, on the other hand all the lakes are disappearing and the state is getting losing a lot of the sandalwood and many other things. So these are the challenges we all collectively are facing. So if there are more questions, yes, you can reach Rahul himself or me, and if there is a need we can do another follow-on session. So thanks again, and good, this is my way of saying thank you to the world, because I don't know much. It's good to find out from others, and help people get exposed to what else is going on, the experts that I consult with. Okay.
I'm constantly learning from you, Shankar. So thank you. It's been a
Well,
very,
we'll
very good
we'll meet
honor.
again. It's time for a real meeting. It's been 8 years, long time. And
That's
thank you
true.
again. And I hope to meet all of you with or without the pandemic. With the pandemic, things are slow and careful, so it becomes virtual. But maybe someday soon, I'll start moving again.
Stay safe, Shankar, and stay safe, everybody.
Stay safe, everybody.
And come to New Zealand when when you're able to.
Sure. Bye
Take care.
now.